Cystic fibrosis, genetic inheritance. What are the ethical considerations? Imagine a world where understanding your genes can help you make important life choices. When it comes to cystic fibrosis, or CF, this knowledge raises some thoughtful ethical questions. CF is inherited in an autosomal recessive pattern, which means a person needs to inherit two copies of a mutated CFTR gene, one from each parent, to have the disease. If someone inherits only one mutated gene, they are a carrier without symptoms but can pass that gene to their children. When both parents are carriers, each child has a 1 in 4 chance of having CF, a 50% chance of being a carrier, and a 1 in 4 chance of inheriting normal genes from both parents. One of the main ethical issues involves genetic testing and counseling. Carrier screening can identify people at risk of passing CF to their children, but questions arise about when and how to offer this testing. It's important that individuals give informed consent, understanding what the results mean and the possible emotional impact. Counseling should be non-directive, supporting personal choices without pressure or discrimination. Deciding whether to test minors or unborn babies is also complex, as it involves balancing the benefits of early knowledge with respecting future autonomy. Reproductive choices are another big area of ethical concern. Couples who learn they are carriers face options like prenatal testing, pre-implantation genetic diagnosis, using donor sperm or eggs, or choosing adoption. Respecting reproductive autonomy means supporting their right to make these decisions, but it also raises questions about societal pressures or stigma linked to genetic conditions. The idea of terminating a pregnancy based on genetic testing results can be morally sensitive and varies across different cultural and personal beliefs. Privacy and confidentiality are vital. Genetic information is personal and can affect not just the individual but their family members too. Protecting this information is essential, but sharing it with relatives who might also be at risk can be beneficial. However, it must be done carefully to respect everyone's privacy. There's also concern about genetic discrimination, where people might face unfair treatment in employment or insurance because of their genetic makeup. Laws and policies are in place in many countries to help prevent this, but ongoing vigilance is needed. Access to genetic testing and counseling can be unequal, depending on where someone lives or their financial situation. Ensuring everyone has fair access to these services is an ethical priority. It's also important to consider the emotional and psychological impact of learning about carrier status or a CF diagnosis. Support systems and counseling can help individuals and families cope with the information and make informed choices. In the end, managing the ethical considerations of CF inheritance means fostering open, honest conversations grounded in respect, compassion, and scientific understanding. It's about empowering people with knowledge while supporting their personal values and choices. As science advances, these ethical frameworks help ensure that genetic information is used responsibly, protecting individual rights and promoting equitable care. Always remember, for personalized advice or decisions, consulting healthcare professionals is essential to navigate these complex issues safely and thoughtfully.